Welcome to the Let's Talk series. The Let's Talk series is a 30-minute video discussion between myself, Dr. Amanda, Dr. Becca, and a local practitioner who understands pelvic health pertaining on topics to women's health and wellness. This series was created to help women navigate their pelvic health wherever they are on the path to womanhood, to advocate, navigate, and collaborate together with a holistic team of allies. Pelvic health healing is multidimensional, and the best outcomes occur with a team-based approach. We invite you to tune into our monthly series to learn more about your pelvic health and engage with our community partners. So welcome to today's speaker, Meghan Carr. Hi, Meghan.
Hi, everyone.
So today, Meghan is a board-certified psychiatric mental health nurse practitioner. So she earned her Bachelor of Science in Nursing and Master of Science in Nursing degrees. And then she spent her last few years working in private practice, treating mental health diagnoses, and is the owner of Resilient Mind Psychiatry in New Jersey. So prior to her advanced practice degree, Meghan had a variety of clinical and nursing experience across the lifespan in both inpatient and outpatient settings. And Meghan prioritizes working with her patients to establish goals in order to achieve successes in patients' personal lives and health journeys. And she customizes care to meet the unique needs of each individual. So thank you. We're so excited to be talking with you, Meghan, today about the relationship between mental health, pelvic health, the role of the nervous system. This is something for all the sciencey nerds out there. Something that, can be not complex, but just many different layers kind of to the relationship between how your mental health affects not only your pelvic health, but every aspect of your life. So we're so excited to not only have you as a resource, but to be able to talk with you today. So thanks for joining us.
Thanks, Dr. Becca. Thank you, Dr. Amanda. Thanks for having me today. And we're going to talk a little bit about how the mind and body connect and the importance of mental health and how it correlates to your pelvic health. And there's sometimes there's misunderstanding that they're not connected and they're completely different, but in reality, they overlap in so many different ways. Where I would like to start today is talking about mental health, what it is, mental wellness, and how it's a little bit different, and what truly is mental illness. I think there's a lot of stigma still affiliated with mental health and illness, and that we should be talking about it the same way we talk about going to the dentist. We all have dermatological health and cardiac health and dental health and hygiene. So why then do we shame away from talking about mental health? It's an appointment we may put in our work calendar that we'll block out as private appointment, whereas when we say we're going to the dentist, we'll put in dental appointment.
That's very true. Very true.
Yes. So mental health is more what we do, it's actions. So I'm going to use the analogy of dental health as we talk about mental health. So it would be similar to brushing our teeth or flossing every day. That's how we need to approach mental health. When we look at mental health, it's breathing techniques and ways we can introduce nutrition into our life, really caring for body and mind. And that is going to promote mental health. Mental health, and I'm sure when you talk about health, Dr. Amanda, Dr. Becca, it's similar. It is not the absence of illness. And that's where a lot of misconception comes in about health. It's not just that we're not sick. Mental health is a journey and it's introduced into our daily lives, and we need to meet our mental health where we're at. And every day that may be a little bit different. So could it be going on a mile walk? Yes. But tomorrow your mental health may be watching an episode on Netflix. So it's really, being in tune with body and mind, and your mental health is not going to look like someone else's mental health. Health and wellness are a little bit different. Wellness is what we are looking to achieve. It is balance. So we could have an amazing mental health and, again, the dental hygiene, be brushing our teeth every day, flossing every day, but still not have the perfect smile, or we may be getting cavities, which is the same with wellness. So it's a spectrum. We're all going to be in different places on the spectrum, but mental wellness is about finding balance and being content in our lives. And sometimes I use the saying, it's about wholeness rather than happiness. what we see when we achieve mental wellness is usually fruitful and dynamic relationships in multi environments within our life, whether it be our social life or our home life or our work life. We're really thriving and we're no longer just surviving.
Okay.
Makes
So
sense.
mental, so I guess to say this again, and I might have confused the two. So mental wellness is like taking care of your cavities. Is that true?
Mental wellness would
Or is that
be
opposite?
perfect, a little opposite. Mental wellness would be
Okay,
having
sorry.
no
I switched it up.
cavities. Or maybe
Okay.
your goal is going to the dentist and just having one cavity. And that
Gotcha.
means
Like
you
your goal.
achieved your mental.
Gotcha. Okay.
Yes.
Like taking care of what kind of comes up as what I would like to have for my desired health of that.
More the goal. So the health is the doing and the wellness is the personal goal.
Ah, okay. That makes more sense then. Okay.
Mhm.
Thanks.
So the health is the things we're going to do. So for example, our mental health, we may do some meditation every day. We may put on some white noise and shut off our television at bedtime. Where the wellness is waking up and feeling good, feeling fulfilled, really knowing that, hey, I'm okay. I'm doing it. I have this. And then we have mental illness. And mental illness is best described as a disruption in that balance. So our work relationships are starting to suffer. Maybe with our partner, things aren't going great. We're irritable, we're agitated. Just because we're feeling some symptoms, though, of being out of balance doesn't mean that we have mental illness. But what we usually see is our functioning starts to decline. We're not doing our activities of daily living. We may be showering or not showering as much, or our appetite could be increased or decreased. We could be sleeping too much or too little. We're not finding enjoyment in daily life where we may have found that enjoyment before, just completely apathetic and indifferent to the world around us. It's a disconnect. There's a wall that's starting to be built. As that wall starts to build, we want to recognize that we're disconnecting and start to focus more on our mental health, what we can do to get back to mental wellness, which is the goal.
Okay. I think that makes a lot more sense because, you know, when we're looking even at the social media landscape, everyone's like mental health, mental health, mental health. But there's these other parts of it that I think we're not using the correct terminology or verbiage to also encourage those other parts. So I see it now from a completely different perspective, but also when we're looking at, and I know this is something you're going to continue to speak about, when we're looking at our clients who have gone through long fertility journeys or child loss or, chronic pain, like those traumas and different things that disrupt our life. They might be an external factor that disrupts our life. I can see then how it does change someone's mental wellness and also like their, just what they're doing for themselves. So, okay, I'm seeing it in a different light. Thank you, Meghan.
Yes. So they're all connected. They all affect one another, but I would say the catalyst is usually caring for mental health. You mentioned social media. It may be your mental health today is deleting TikTok, but tomorrow you might be re-downloading it. So it's meeting yourself where you're at.
Which is something we say often in the office too. Yeah.
Why they're the same.
Exactly.
So what you kind of mentioned, Dr. Amanda, was how mental health does affect your pelvic health, but then it's vice versa, and your pelvic health affects your mental health. So we'll start a little bit, and maybe you'll want to touch on too, how your pelvic health affects your mental health. Because if you are suffering with pain, dysfunction, discomfort, loss, you're going to have feelings of being out of control of your own life. And when we have a loss of control, what usually sets in is stressors and anxieties, because what anxiety really is a loss of control. Very true.
Yes. I think sometimes when people say, oh, I have anxiety, they just think they're just nervous, but there's a deeper causation for that to recognize, yes, I'm feeling out of control.
Stress and anxiety are very different. Stress isn't always a bad thing in our lives. It helps us to function to that higher level, whether if it's Adele getting on stage and having some stress to help her hit those high notes.
Right.
Or maybe that little bit of stress before a race to help you hit your certain mile time. Stress is not always a negative, but it's how it affects our life. And if it starts to cause an imbalance, that's when it truly becomes anxiety.
That makes sense. That makes sense.
So then we have the mental on the pelvic, which brain and body are connected. We have our central nervous system, which is, and we'll go a little anatomy right here. Our central nervous systems are brain and spine. And then we have our peripheral nervous system where all those nerves branch out. And in the peripheral nervous system, we have the autonomic, which is your rest and digest and your fight or flight. So when we are stressed and anxious, we are going to be in fight or flight. Our muscles go like this. Our jaw tightens. We're grinding our teeth. We notice our posture starts to suffer. What we don't always notice is our pelvic floor muscles. Maybe you want to talk a little bit on that.
Yeah.
Yeah. Well, I think there's an actual study out there where they've actually done like EMG studies. Yeah. And they've shown women, so they've put up sensors to like the neck, upper trap area, because I know everyone thinks about like
stress is here.
Yeah,
right.
Everyone carries their stress here. So they had sensors both the neck, upper trap area, and then down at the pelvic floor. And then they were shown like stressful images or upsetting, disturbing images, movies, pictures. Just a picture screen. It wasn't even like, you know, like, oh, your dog died, or, you know, whatever it was. So, and then kind of seeing where the muscle activation was happening. And it was interesting because in women, more of the muscle activation was actually happening in their pelvic floor than it was in like the neck and the upper trap compared to males.
The rest of the body. Yeah.
Yeah. And compared to the rest of the body too. Yeah. So I think so often subconsciously, you know, we walk around and we don't even realize. And to go with your dental analogy, when I'm at the dentist, my shoulders are literally up here and I have to keep reminding myself, I'm like, okay, relax. And then 5 minutes later, my shoulders are up here again. And I don't know how they got there.
You're not
like
saying, let me lift my shoulder.
Yeah, I didn't do it, but all of a sudden I'm up here again. So that's where I think Dr. Mann and I both, and I'm sure you with your clients as well, just working on mindfulness, doing some body scans throughout the day, taking moments in your day to just kind of pause and think about, okay, like, how do my hands feel? Are my hands tense? Am I clenching my toes? Am I squeezing my butt? You know, am I sucking in my belly? Taking those moments kind of repeatedly throughout the day to just check in with yourself, because again, it's not like we know or are in control of these things that are happening. It's just our body's, our nervous system's protective mechanism, you know?
That's exactly what it is. Fight or flight is not always a bad thing. If we're being chased by a bear, we want to be able to run. But I was at the dentist on Monday and I sweat through my jeans.
Yeah.
And that's one of our reflexes that comes from that nervous system. We are going to have sensory responses. There are going to be muscle control responses, that tightening, our reflexes, our hormone levels are going to change. That is our stress response. So we say then, well, what can we do? What can we do to help ourselves? And how then, what are my choices? Because if I'm feeling out of control, the goal is to regain control. And I find that normally we have, when it comes to mental health, 4 options, which the first, psychotherapy. One of them also is healthy lifestyle choices. We have the option of medication always there, and social supports. When we look at healthy lifestyle choices, it's going to be, can I introduce a little bit of meditation? Can I step away from alcohol a little bit? Are there more fruits and vegetables because one of the things when we have stressors and our nervous system starts to respond, we can have constipation and trouble, maybe even with libido, because we're so stressed and our hormones are responding. So prioritizing healthy lifestyle choices. So maybe eating more fiber or having more intimate time with a significant other to encourage that vulnerability in our relationship. So healthy lifestyle choices. It doesn't always need to be cutting out all sugar and starting a marathon plan.
Right.
I think
and knowing what your body's like signals or warning signs are, like you had mentioned, kind of recognizing when maybe, you know, things are being more disruptive to your life before it kind of spirals into a complete like feeling of loss of control, but knowing what your body's like warning signs are. I know for me, it's like that pit in the stomach. Like I get nauseous. I might have more urgent bowels. And I'm like, okay, like what am I so, you know, like nervous or anxious about, or that sort of thing. But it took me a while to realize that that's why I was having these, like, I thought I'm eating too close to bedtime. You know, it's just, I wasn't listening. Yeah. I would wake up feeling nauseous every morning. I'm like, okay, I'm not pregnant. Like, you know, I'm not this.
Right. All the things.
Right. I'm not like, you know, maybe I'm eating too much of this, or I need to eat less right before bed, or, you know, and it was just my body's kind of way of communicating like, hey, you're not listening to me.
Right. And I think you brought up a great point. And Meghan, maybe even for your practice as well, is that when something is wrong in our bodies, we tend to think it is everything else, but the potential stress that could be looking at us every day, whether that is something like child loss or planning a wedding or, you know, planning for a big work event. And we're like, now I have to take Miralax so I can poop well. Or now I need to start, you know, I'm going to have my glass of wine more every night, like making those choices, when instead we sometimes can just step back and go, maybe I need to say no to some things or create a different boundary. And a lot of people too, probably also will contact somebody and say, I need medication. And it's like, that's one piece of the puzzle that if we wrap it all together, we have much more, you know, efficiency and efficacy for our whole body. So
absolutely.
Yeah, I think too, there doesn't have to be this big like triggering event that your body's reacting to. Because in those moments where I was waking up, like with that, like if you had asked me, like I thought I was pretty happy, you know, I was like, I liked my job, I liked my coworkers, I had a very vibrant social life in New York City, my relationships were good. You know, I overall was in a really good place. I didn't have like one thing that was really, I was really stressed about or dealing with or anything like that. It was just a multitude of different ways in which I wasn't caring properly for my body, between my sleep, my like just balancing kind of things in my life that just built up over time that then just kind of, you know, bubbles over. So I think too, when we bring it up with clients, it's, you know, again, there's a stigma behind it of it's, you know, life is stressful. We're not saying that like you have, or people think that like, oh, well, my life is pretty good. You know, I had a pretty good childhood. I have a good family support. I have a good social system, and all that is great. But that doesn't mean that your mental health or wellness is where, you know,
where you would
like it to be. Yeah.
There's one common theme that we're all touching on, and it's self-awareness. Let's have check-ins with ourselves. Where are we on our spectrum? Are we in that green go zone? Are we in that yellow zone where we need to really evaluate where we're at? Or are we in that red zone where we need to back off and start bringing in some of these interventions or lifestyle choices? Being self-aware, knowing where we are right now and where we are going, is going to lead to an increased quality of life. And that's the ultimate goal. What you talked about too, Dr. Becca was saying, you know, we had a great childhood. Everything was roses and good. But the truth is sometimes it's not what happened to us or what we experienced, but sometimes what didn't happen to us. And that's a large misconception about trauma. So seeing something, experiencing loss, watching something really traumatic, being tied in close to a traumatic event, those are all negatives, but there are also what didn't happen, which could be something like neglect, not having our emotional needs met, not having secure attachments growing up, not having someone say to us, how are you doing? So those are areas where we don't always look for trauma in our life. So there's 4 different types of trauma that I hit on with my patients, which is emotional, physical, verbal, and sexual. And these traumas will represent throughout our life if not addressed, which comes back to caring for ourselves, looking into psychotherapy, those healthy lifestyle choices, social supports, and medication. And we touched on medicine, and some people do just, let's fix this real fast with a pill. I'm coming from a psychiatric standpoint. I think medication's great and it has its place and it can absolutely save lives. But We also have areas of our life where we can control through bringing in social supports. Can we join AA? Is there a book club we can join? Because when we introduce social supports, we're going to get empathy and understanding and different viewpoints from our community. We are going to gain a sense of purpose. We are going to be able to connect with our world and expand our worldview in ways we didn't know possible before. So along with introducing medication and maybe on the topic of trauma, having an EMDR specific therapist, which is a trauma approach to care. Let's see maybe if we can join a trauma support group. Can we even join a bowling club where people may be experiencing or may not have experienced something we went through in our life? So that's my point of view on medication. And when I prescribe, I think that being conservative is most important, and starting low and going slow. And if you decide to start a psychiatric relationship with a provider, whether it be a psychiatric nurse practitioner or a psychiatrist, really having a consult call. You're going to be opening up some of your past traumas and wounds. Make sure you feel comfortable. Make sure that they're going to offer you a full half hour. Make sure that their communication style is similar to yours. I use the analogy when we're looking for a psychiatric provider or even a therapist, which we'll touch on the difference, is similar to looking to a hairdresser. So my hairdresser, Dr. Amanda, you may not want to see him. Dr. Becca, I may really want yours, but he may not like, or she may not, or they may not like my hair. So just because someone doesn't cut my hair right, or I don't like it, doesn't mean that there's something wrong with the hairstylist or with my hair or my head. What it really comes down to is a good fit. So when we look to bring any provider into our treatment, we want to look and advocate for ourselves in finding a good fit. Is it okay then if I touch on the difference real fast?
Please do.
Yes.
I think that's I think a big thing of how I'm so proud of you of seeing your journey into the mental health landscape and being something different that we don't always have the opportunity to refer to or to interact with. We have tons of relationships with really beautiful licensed social workers or counselors or other mental health practitioners. But I think what you are able to offer, Meghan, is something really unique that people might not know that there's something there that is different from like, oh, I've got to see my psychiatrist. Like, I think a lot of people are like, oh, then I must have this, mental health issue that is so much that I only need to see somebody like that who only provides medication, when really, like you're saying, it could be, you have to touch on all the things. So I want to hear definitely about the difference so people can understand.
So we have psychiatry and we have psychology, and it's a little different to know the difference. Psychiatry comes a lot more towards medication and integrative care, talking about supplements, talking about antidepressants, SSRIs, benzodiazepines, maybe some stimulants with ADHD or with obstructive sleep apnea, we treat sometimes with stimulants. So knowing, and we think, as I mentioned before, medication is a last choice, where we can be proactive by seeing a psychiatric provider, which usually is a physician's assistant, someone with a master's level degree. So a physician's assistant, a psychiatric mental health nurse practitioner, or a psychiatrist, all a little bit different in the way they approach care, but getting similar results. One of those things where you want to find what's a great fit for you. But when we go to establish the care with a psychiatric provider, it can be proactive. It can be, hey, I think I may need medication in the future. What could be some options for me? Do you have an integrative approach? Do you feel comfortable talking to me about some supplements, maybe introducing a magnesium at bedtime, or how can I benefit from melatonin? Is melatonin okay? These are questions that we can talk to a psychiatric provider about. Whereas when we look to the psychological view, which is a therapist, a psychologist, a licensed marriage family therapist, LCSW, LAC, LPC, they are going to come from either a cognitive behavioral standpoint or trauma standpoint. There's different types of psychotherapy, again, finding what fit would be appropriate for you, but they do not have the ability to touch on the medications and supplements. Again, we shouldn't wait until we are at, I always say, rock bottom to reach out for help. Because when we go to establish a psychiatric or a therapeutic relationship, when we're feeling all the feels it's going to really be difficult to talk about what our baseline is and what our goals are, because we are in this fight or flight, I'm not okay mode. I need to go back to thriving. And right now I'm in surviving. So being proactive and starting a relationship with your counselor or therapist prior to really getting into the red, maybe look for your yellow signs and say, hey, it's time for me to go on psychologytoday.com and start looking for my good fit. So that's where I kind of describe the difference in psychiatric and psychological. Most psychiatric providers, including myself, do offer a little bit of psychotherapy during sessions, whether if it's hitting on thought distortions or behavioral techniques to bring into your care. But it's nice to have both. And it's nice to have collaboration between your therapist and your psychiatric provider. And I encourage that. And I, in my own private practice, really dwell on the importance between a collaborative relationship of your therapist and your medication management provider.
Mm-hmm, absolutely. And that kind of is similar to some of our clients when we're being proactive, you know, when we have our moms who come in with a substantial perineal trauma tear, like a grade 3 or a grade 4, we're on it. And like, you need to go see the urogyne who specializes in this, even if they're not having healing difficulties or maybe as much incontinence as they might expect, or as we might expect. It's important to step into that time and say, okay, what are my options? Because what I've noticed too, and this is what I would encourage everybody to think, is when you go talk to another provider, it starts to shed light on something that you might be experiencing, but you're not aware of because you're so ingrained in that survival mode. So I think that that's really important for people who are seeing a counselor. Might be, yeah, we need to have a relationship with someone like Meghan who could give me some other insight. I think that's super important.
Knowing your options. And you just mentioned that, Dr. Amanda, the more we know our options, the more empowered we are. And the more we feel back in control in these scenarios where we feel that we don't have control. So that's really a takeaway from today. Let's open up our options. Can we even go on Psychology Today and pick out a couple of providers? So if we get to that yellow zone, we may feel comfortable to reaching out. Breaking things down into steps. We don't have to always be all or nothing. So if you are to see a provider for psychiatry purposes, it does not mean that you need to start on your SSRI, you need to start on a benzodiazepine. No, let's start low and go slow. Let's meet you where you're at. And that's the goal of a great psychiatric or therapist, is to really meet you where you are at. So we talked about meeting ourselves where we're at, but we need providers to meet us where we're at in our care.
Yeah, that's awesome.
Yeah. And I think, you know, what you said of, you know, finding the right fit with people and kind of doing your homework, do a consultation, make sure, you know, that this person is actually going to spend the time with you and listen to you and kind of get to know, okay, you know, like, what are your wellness goals, or what are you looking for out of this relationship as well? This brings to mind a client of mine who has been dealing with chronic pain since she had her first child. And I can't remember if it was her PCP or GYN or whomever she was talking to about this pain. And they told her that she had postpartum depression and wanted to put her on antidepressants, because they're like, you know, she answers the questions like, are you sleeping? Are you able to do, you know, whatever the questions are? And she's like, well, no, I can't do any of this stuff because I have all this pain.
Right.
And they told her like, no, you just have postpartum depression, and wanted to put her on medication. Versus actually really listening to kind of what she was trying to tell them.
And that medication could help someone.
Yeah.
But if her vulvar tissue was screaming in need, well,
yeah.
you know.
Yeah. So fortunately, I think she did realize that maybe this is not the best fit for me, but it took her then a while to kind of, you know, I think that's a very similar story with a lot of our chronic pain patients. If they've seen at least 7-8 different providers before they're getting to us even. So,
but how many people I mean, we don't have to share a number, but how many people did we each date? Like when you're in that relationship finding scene, like how many people did you date? Did you date one and that was like it? Or did you date 100? Because you had to find the right communication styles, like you were saying, Meghan, and the right personalities, and the person who had the skills that met you where you are.
you get burnt out. It's exhausting. And you feel that you keep telling, I don't really love the word story, but you keep telling your history and your presentation and where you're at as a patient. And you're like, who else? That's why I named my practice Resilient Minds, because the patients who finally usually do reach me have been resilient in seeking care that they deserve. They deserve to be heard, and they don't give up. So if you are one of these patients or clients on a journey similar where you need to keep trying, don't give up. There is a fit out there for you.
Yes, so true.
I would like to touch real fast, as I know our time's coming to a close, on a skill I teach my patients, and it's called the BRAIN acronym. And when we're making decisions in our life, whether if it's towards our mental health and wellness journey, or maybe it's towards our medical care in general, or finding a good provider, I like to always use the BRAIN acronym. So what it stands for are, let's use, for example, you're considering starting Zoloft, an SSRI or antidepressant. What are the benefits of this medication? What are the risks? That's the R. The A are alternatives. The I is what your intuition is telling you. And the N part of the BRAIN acronym stands for what happens if I do nothing? So for example, an alternative could be bringing in some form of pelvic PT to help with pain that maybe you're treating for psychiatric reasons, like the client you brought up, Dr. Becca. Or what about if we, our intuition's telling us that this Zoloft just isn't a good fit. And then, so what happens if we do nothing and wait another 2 weeks and just see how things play out if you were to start some PT? PT could be an alternative, but really just looking past benefits and risks to any decision we make in life and going that next step to the BRAIN acronym: benefits, risks, alternative, intuition, and doing nothing. Doing nothing is a wonderful option sometimes, and waiting another week and rechecking in.
It can be.
Yeah. Yeah. I think we talk about that a lot just in the pelvic health world with, pregnancy and birth, and
exactly.
when
you're preparing for these unknowns.
Yeah.
What are the risks and benefits?
But I mean, I feel like that acronym can apply to like any area of your life. I'm like, I'm going to start using that acronym.
You come to picking on a nail polish color.
Yeah. Literally any decision, any big decision you're trying to make. I always make fun of my fiance because he's a big pro cons list kind of guy.
Take him to the next level.
He has to, he likes to write it all out. I'm going to introduce to him the BRAIN.
I think that's good. We need post-its around the office
because
just say
BRAIN. We don't want to just think benefits and risks. Like, we need to be thinking larger scale than that too.
More options, more empowerment. You're in more control. Let's really know and have those check-ins.
I think that would be a great thing for us in the office, and for anyone who's watching too, is to start utilizing that, as a way to even prompt what to do next. Because I think a lot of people are consumed with, well, this Facebook mom group told me to go here, and thankfully it seems to be Breathe Life Therapy many a times, which is really lovely, but sometimes it's just not the right fit. And we understand that. Or, I'm taking this birth class, or I went to go see, or I started using this cream or something like that for whatever, a menopause related symptom. But really, like, that might just be a way to start stimulating the conversation within themselves even more, before they even go see a provider or something, to feel that provider out. So yeah, so many good things to use that for. Yes.
And the biggest piece is the intuition. I feel like, intuition. What is your gut telling you?
Absolutely.
Like, you could be really psyched about all the benefits of this one option.
Absolutely.
But if your heart's not in it, if you're not ready for it, if your intuition, if it's like feels scary or threatening to you, it's not,
Yeah. And I think from our perspective too, and the psychosomatic, relationship from that intuition into our pelvis, a lot of the time sitting in and thinking, okay, what is, even like holding your hands over your low belly, thinking, what is my deep sense of self and my deep root? If you're into the chakra thought process of things, what is that telling me about my intuition? And it's phenomenal when we are working in the pelvic space that there are so many enlightening moments of that intuition part that come up for people. They're like, yes, I do want to take this medication. I actually think my marriage is not a great place for me. We've seen that probably many a times, or I'm not ready for another child, or I don't want another child. So there's this very beautiful thing that I think happens outside of, for us, the physical part. Even though we're physical therapists, there is this intuition that starts to stir. And that's when we refer to our lovely colleagues to say, hey, let's touch on this a little bit more. I can guide a little bit, but that's not my place to do. So
relationship with self is so important, and it's usually not the one that we are prioritizing, ironically enough.
Yes. Yep. That's so true. Oh my gosh. We could just end it right there. That was so powerful, Meghan, that it was so, so true. I'm going to make that our title for this. Beautiful.
So Meghan, if people are interested in like working with you or just connecting with you, learning more about you, how can they find you?
Yeah, please reach out. My website is resilientmindsnj for NewJersey.com. My Instagram is at resilientmindsnj. And if you would like to send an email, Meghan@resilientmindsnj.com. You can even send me a text message or a phone call, 908-308-2048. Please.
We'll
I will look forward to meeting you
on the social media. That'll be on our video. It'll be in the emails as well. And yeah, I mean, please, everyone who's listening, don't feel fearful to reach out to somebody who has this expansive knowledge. And Meghan, you're bringing it for so many people and shedding light to so many places in our minds. So thank you so much.
Thank you for having me. I really enjoyed this, and I hope everyone can feel a little more empowered in knowing their options today.
Absolutely.
Thank you.
Thank you.